It's Wednesday, November 13th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, plus a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, low LDL cholesterol and blood pressure can slash lifetime cardiovascular disease risk.
Statins in kids cut long-term cardiovascular disease risk in familial hypercholesterolemia.
We'll review some expert strategies for diagnosing and treating onychomycosis.
And a novel artificial intelligence algorithm shows promise for diagnosing benign thyroid nodules.
Plus, why the tide may finally be turning against vaccine hesitancy. But first, thanks again to everyone who's helped us make this podcast better by taking our short listener survey. For those who haven't, we invite you to take a moment to complete the survey by following the link in the show notes. And now, the news.
Maintaining lower LDL cholesterol levels and lower systolic blood pressure over time may be the key to preventing cardiovascular disease. New research shows that any reduction of LDL cholesterol and systolic blood pressure in any combination lowered the lifetime risk of cardiovascular disease. The relationship was independent, additive, and dose-dependent. Over the course of years or decades, it could lower risk as much as 80%. Dr. Brian Ferentz is the study's lead investigator and executive director of the Center for Naturally Randomized Trials at the University of Cambridge in England. He said the findings appeared to confirm that most cardiovascular events are preventable. The findings also validate current guidelines that focus on a lifetime approach to cardiovascular risk reduction through lifestyle interventions. The study used data from more than 400,000 participants in the UK's Biobank database. The investigators sought to quantify the association between LDL cholesterol, systolic blood pressure, and atherosclerotic cardiovascular disease. They found that participants with long-term exposure to the combination of lower LDL cholesterol and lower systolic blood pressure had an 80% lifetime reduction in cardiovascular events, a 75% reduction in the risk of myocardial infarction, and a 68% reduction in long-term risk for cardiovascular death. These data were presented at the annual Congress of the European Society of Cardiology.
New findings support starting statins in children with familial hypercholesterolemia. In a long-term follow-up study of prevestatin in children, researchers found that starting statins in childhood for patients with familial hypercholesterolemia reduced progression of carotid thickening and cut the risk of cardiovascular disease 20 years later. These positive effects were observed even though only 20% of patients met LDL cholesterol goals in the study. If confirmed, the findings provide support for current pediatric guidelines, which recommend starting treatment from age 8 or 10 years with less stringent targets than used for adults. The study was based in part on follow-up visits with 184 of an original cohort of 214 patients with familial hypercholesterolemia in the 2-year prevestatin study, along with 77 of 95 unaffected siblings who served as a control group. At the time of the 20-year follow-up, nearly 80% of the familial hypercholesterolemia patients reported that they were using lipid-lowering medication. In all, 7% of affected parents had died of a myocardial infarction before the age of 40, but there were no deaths from cardiovascular causes in any study patients with familial hypercholesterolemia. Similarly, about a quarter of affected parents had a cardiovascular event before age 40, but there was only one event recorded in the study patients. The findings were reported in the New England Journal of Medicine.
Well, there's no such thing as a classical presentation of onychomycosis. That's according to Dr. Neil Bhatia, the director of clinical dermatology research at San Diego-based Therapeutics Clinical Research. He offered his tips for diagnosing and controlling recurrence at Skin Disease Education Foundation's annual Las Vegas Dermatology Seminar. For diagnosis, Dr. Bhatia said using visual assessment has a sensitivity of 77% and a specificity of 47%. KOH staining has a sensitivity between 67 and 93% with a specificity between 38 and 78%. PCR, on the other hand, is quick but expensive and carries a high false positive rate. So, for difficult patients who aren't responding to treatment, don't trust your eyes alone. For controlling recurrence, Dr. Bhatia recommends using a topical antifungal twice a week for 2 to 3 years. Periodic application of a topical antifungal to the plantar surface and the interdigital spaces, treating immediate family members, decontaminating footwear and socks with antifungal powder, and avoiding communal swimming pools. Skin Disease Education Foundation is owned by the same parent organization as this news company. The Daily Medical News will be right back after this.
Artificial intelligence may offer a better way to evaluate thyroid nodules and reduce biopsies. A new image analysis algorithm for benign thyroid nodules that uses a technique similar to facial recognition showed good sensitivity and specificity with the potential to significantly reduce biopsies. The negative predictive value of the ultrasound analysis algorithm was about 93%. That approximates the false negative rate of about 5% that is seen in fine needle aspiration of thyroid nodules. Dr. Johnson Thomas is an endocrinologist with the Mercy Healthcare System in Springfield, Missouri. He noted that millions of people have thyroid nodules, and fewer than 10% turn out to be malignant. But patients have to undergo biopsy to find out their status. Dr. Thomas designed an algorithm dubbed AIBX that uses a convolutional neural network to build a unique image vector for each nodule. The algorithm then turns to a training database of images to find the closest matches. For instance, a test image of a benign nodule would have an output from the AIBX analysis of 3 similar images from the database, all benign. Then the interpreting physician could use the algorithm as a decision aid. The overall accuracy of AIBX was 81.5%, with sensitivity of 87.8% and specificity of 78.5%. The positive predictive value was 65.9%. The model could ultimately be deployed as an app, integrated with medical imaging systems, or hosted as a website. Dr. Thomas presented the findings at the annual meeting of the American Thyroid Association.
And finally today, there's some good news when it comes to public opinion on vaccines. Dr. Paul Offit, a professor of pediatrics in the Division of Infectious Diseases at Children's Hospital of Philadelphia, or CHOP, said there's growing pushback against anti-vaccination efforts. Speaking at the annual meeting of the American Academy of Pediatrics, Dr. Offit laid out his case for why vaccine hesitancy may be waning. The shift began with the measles outbreak in Southern California back in 2014. That outbreak spread to 25 states and was in the news almost every day, which began to turn public opinion against the anti-vax movement. Then, state lawmakers began pushing back. In 2019, legislators from California barred parents from not vaccinating their children due to personal beliefs, and lawmakers in New York repealed the religious exemption on vaccinations. A similar exemption was repealed in Maine. New Jersey lawmakers passed a requirement for detailed written explanations for religious exemptions. Now, social media platforms are making it harder for anti-vaccination advocates to spread false information. Pinterest restricts vaccine search results, YouTube removes ads from anti-vaccine channels, and Facebook has taken steps to curb misinformation about vaccines. Even Amazon Prime pulled anti-vaccination documentaries from its video service. Dr. Offutt also offered tips for talking to parents who are skeptical about vaccines or refuse them. He tells parents that passing on the opportunity to vaccinate their child is not a risk-free choice. It's a game of Russian roulette. He advised physicians to check out the Vaccine Education Center that he and his colleagues created at CHOP. It provides complete, up-to-date information about vaccines, including the purpose of each one and the relative risks and benefits. You can find this information in the show notes. And that's it for today's Daily Medical News. Remember to check out the newest episode of the MD Edge Psychcast for psychiatry and psychology. New episodes of the Psychcast are available each and every Wednesday. For MD Edge, I'm Nick Andrews.
And I'm Mary Ellen Schneider. Thanks for listening.